Hi, Veronica. I'm assessing my patient from head to toe. He's 51 years old male. I've washed my hands, cleaned my stethoscope with alcoholic swab. My gloves are worn and I'm good to go. Hi, I'm Veronica, your nurse today. I'll be assessing you from head to toe. Is that okay? You want to use the washroom before we get started? No, I'm going to provide you with privacy. I'll cover you with this blanket for comfort. I ask you to state your last name and your date of birth. Thank you. For general appearance, his color is consistent with the rest of the body and he does not have body odor. He is sitting upright. The body is symmetrical. He has adequate nutrition. His height and weight is consistent with his age. He's maintaining good eye contact, speaking fluently, and well dressed, has good personal hygiene. He's awake and alert. Can you state your name, where you are, the time, and the place, and the time and the year? And he's oriented 3 times. He does not have difficulties breathing, and there's normal rise and fall of the chest. Can you walk to the door? Yes. He has good range of motion and stability. His head is round and normal cephalic. There are no visible scars or lesions at the moment. I'm going to palpate for temperature, which is consistent with the rest of the body. I'm also going to palpate for tenderness or pain, any masses, any lumps, or any swelling or fractures, and there is none. The hair is evenly distributed, it's black and thick in texture, and I don't find any evidence of lice present. The face is symmetrical. The color is consistent with the rest of the body. No abnormal facial hair and no abnormal movement of the face. I'm going to palpate for the temperature of the face, which is normal with the rest of the body. I'm going to palpate for any lumps, any tenderness or pains, any scars or lesions, or edema, and there is none. I'm going to test for cranial nerve number 7, which is the facial nerve. I'll ask the patient to frown, to smile, show me your teeth, raise your eyebrow, close your eyes very tight so that I'm not able to open, and puff your cheek. This was done symmetrically, which means that the nerve is functional. The eyelids are symmetrical, the eyebrow are symmetrical and evenly distributed. No sign of ptosis or lid lag, no crusting or discharge. The sclera is white and the conjunctiva is pink. I'm going to test for cranial nerve number 3, which is the oculomotor nerve. The pupil appear to be around 2 millimeters and symmetrical, bilaterally. I'm going to test for direct and consensual light reflex. I'll flash my light on the right eye, the right eye comes straight. I flash it the second time and the left eye comes straight. I flash the light on the left eye comes straight, and when I flash it the second time, the right eye comes straight. To test for accommodation, please look at the wall. When I bring my finger closer to your eye, focus on my finger, okay? The eyes converge and the pupil comes straight. The ears are symmetrical, the color is consistent with the rest of the body, and there is no foreign body present. I'm going to palpate the auricles and the trigals for tenderness. Do you feel pains? No. I'm going to test for hearing impairment. Please occlude your left ear, and I'm going to whisper behind your left ear. 1S6. What did I say? Please occlude your right ear, and I'm going to signal behind your right ear. 147. What did I say? The patient does not exhibit any sign of hearing impairment. The nose is on the midline, no nasal flaring, no crusting or discharge. The color is consistent with the rest of the body. I'm going to palpate the frontal sinuses and the maxillary sinuses for pain, which appears to be. Do you feel pains on palpation? No. So the patient does not have sinusitis. The lips appear pink, moist. Can you open your mouth? The gum appear pink and no bleeding. Can I see your teeth? They appear white and 32 in number. I'll use a tongue depressor to examine your tongue. It's on the midline and no atrophy of the tongue. The soft and the hard palate appear pink and intact. I'm going to test for cranial nerve number 9, which is the glossopharyngeal nerve, and cranial nerve number 10, which is the vagus nerve. I'll ask you to say, the soft palate and the uvula rises, which means that both nerves are functional. I'm going to test for cranial nerve number 12, which is the hypoglossal nerve. I'll ask the patient to stick his tongue out, which is on the midline, and then roll it from side to side. Say light, tight, dynamite. No tremors observed, which means that the nerve is functional. The neck is on the midline, is symmetrical, the color is consistent with the rest of the body, no visible scars. The trachea is on the midline and no abnormal inflammation of the thyroid gland. I'm going to palpate for the temperature, which is consistent with the rest of the body. I'm going to palpate for any masses, lumps, tenderness or pain, or any lesions, and there is none. I'm going to palpate the carotid artery for the pulse. First on one side for 30 seconds and on the other side for 30 seconds. It is 68, the strength is 2+, and it's regular on both sides. Next, I'm going to assess the spinal accessory nerve, which is cranial nerve number 11. I'm going to place my hand on his left side. Please turn your head to the left against my resistance. And I'm going to place my hand on your right. Please turn your left towards the right against my resistance. Shrug your shoulders against my resistance. The patient was able to do this without pain, which shows that the nerve is functional. There's symmetry of the upper extremity. The left hand is the same like the right hand. There's even distribution of the hair. The color is consistent with the rest of the body. No visible scars present. No sign of diaphoresis. And I'm going to palpate for the temperature, which is consistent with the rest of the body. I'm going to palpate the joint for tenderness or pain. I'm going to palpate to feel for muscle bulk, the tone, turgor, feel for moisture, and all appears to be normal. I'm going to palpate the radial pulse for 1 full minute on both hands, and it's 68. The strength is 2+, and it's regular on both sides. I'm going to the capillary refill is less than 3 seconds, and the nails appear to be pink. I'm going to conduct range of motion exercises, flexion and extension of the fingers, inversion and evasion of the fingers, flexion and extension of the wrist, radial deviation and ulnar deviation, flexion and extension of the elbow, supination and pronation of the elbow. Shrug your shoulders, adduction away from the midline, adduction towards the midline, internal and external rotation of the shoulder. The patient did this and I didn't observe any sign of pains, crepitus, or altered range of motion exercises. I'm going to test for grip. Please grip my hands very tight. It's very strong and regular. The lower extremity is symmetrical. The left leg is the same like the right leg. There are no visible scars, no edema, and no the skin color is consistent with the rest of the body. And I'm going to palpate for the temperature, which appears to be normal with the rest of the body. I'm going to palpate for joint tenderness or pain, to feel for muscle bulk, turgor, moisture, any lumps or fracture, and there is none. I'm going to assess the dorsal pedialis pulse here for 1 full minute on both legs, and I'm going to assess the posterior pedialis pulse here for 1 full minute. It is 68, the strength is 2+, and it's regular on both sides. If this is my patient's limb, I'm going to test for plantar flexion against a resistance and dorsiflexion against a resistance. It's strong and normal. Next, I'm going to wash my hands. I'll change my gloves and I'm going to examine the posterior thorax. Can you take off your shirt so that I can examine your back, please? Thank you. I'm going to cover you with this blanket when I'm assessing your back. Is that okay? The back appears to be straight, no sign of kyphosis or scoliosis. The symmetry of the back and the color is consistent with the rest of the body. I'm going to palpate for any tenderness or pain, any swelling, any masses or any lesions, and there is no abnormalities. The transverse ratio is 2, that side to side is 2. The anterior posterior ratio is 1, which is a normal assessment indicating that there is no barrel chest. I'm going to test for chest expansion. Please, I'm going to grab you some adipose tissues below your rib cage and ask you to breathe in and then out. When the patient breathes in, my fingers separate, and when he breathes out, they go back to normal position, which indicates the normal rise and fall of the chest. I'm going to test for tactile fremitus in order to feel for vibration. When I place my hand, the heel of my hand on your back, please say 99. Is that okay? 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, and 99. The vibrations were normal. I'm going to assess the lung sounds with my stethoscope. I'll place it for 1 full minute in order to listen for the breath sound. Beginning from the top, please breathe in when I place my stethoscope. Is that okay? I'm going to place my stethoscope for 1 full minute. The vesicular sounds were heard in the peripheral area, and the bronchovesicular sounds were heard in the middle area. The lung sounds were very clear. Respiration is 16 and very strong and regular. No wheezing or crackle sounds were heard. Next, I'm going to examine the anterior thorax. Please, I'm going to cover you with this blanket. For the assessment of the anterior thorax, the chest is symmetrical. There is normal rise and fall of the chest, and the color of the chest is also consistent with the rest of the body. Respiration is 16 breaths per minute, which is the regular assessment. I'm going to assess for the lung sounds using my stethoscope. I will place my stethoscope for 1 full minute in order to assess for the valves, the heart valves. Please, I'm going to ask you to. The patient is properly draped, and I'm going to assess the heart valves. I'm placing my stethoscope on the second intercostal valve on the right in order to listen to the aortic valve. Here, S2 is louder than S1. I'm going to place my stethoscope on the second intercostal space on the left to assess for the pulmonary valve. Here, S2 is louder than S1. I'm going to place my stethoscope on the third intercostal space. Here is the Elf's point, and the S1 is the same like S2. I'm going to place my stethoscope on the left sternal border on the third intercostal space to listen to the tricuspid valve. Here, S1 is the loudest, and I'm going to place my stethoscope on the fifth intercostal space. Here is the mitral valve, and I'm listening to the heart rate. It is 68, it's regular and strong. I'm going to examine the abdomen. I'm going to drape the patient, and I'm going to expose only the abdomen. First, I'm going to observe. I'm going to inspect the abdomen. Yeah, the symmetry of the abdomen. No stretch marks. No sign of edema. The skin is consistent with the rest of the body, and the umbilicus is on the midline, and no sign of abnormal pulsations at the moment. I'm going to use my stethoscope in order to assess the bowel sounds. In order to assess the bowel sounds, beginning from the right lower quadrant. Right lower quadrant, go first. And then right upper quadrant. Then the left upper quadrant, and then left lower quadrant. 8 abdominal bowel sounds were heard. Normal peristalsis movement of the bowel, and no sign of abnormal regurgitation. Next, I'm going to do light palpation on the 4th quadrant in order to assess for any superficial masses or any sign of distension or in the abdomen. So I'm beginning with the palpation of the right lower quadrant, the right upper quadrant, the left lower quadrant, and the left lower quadrant. Next, I'm going to palpate. I'm going to drape the patient, and I'm going to palpate the bladder. I'm going to palpate the bladder for any sign of distension. There are no signs of distension of the bladder or any sign of the bladder being full. Thank you. That ends my examination.